Diphtheria has left an inmate dead at the Pollsmoor Correctional Centre in the Western Cape. The Health Ministry says the 19-year-old male showed diphtheria symptoms at the end of October and was referred to a local hospital for further medical care. 8 other inmates have tested positive for the disease so far. For more on this, child health specialist at the National Health Department, Dr. Lesley Bamford, joins us now live via Zoom. Doc, thank you so much for your time. I don't know much about this particular bacteria infection. Can you tell us a little bit more? What kind of symptoms do you have to look out for?
So diphtheria used to be an extremely common disease, but luckily due to vaccination, it has now become a very uncommon condition. However, unfortunately, we do occasionally see cases. So basically, there are sometimes some non-specific signs, but patients mostly present with a sore throat, maybe with some hoarseness. That can go on, and they may often also have swelling of the lymph nodes of their neck. So that combination of sore throat, hoarseness, swelling of the neck, those are really the symptoms of diphtheria. Unfortunately, in severe cases, other complications do develop, and other systems such as the cardiac, the heart, kidneys, and nerve damage to the nervous system can also ensue in more serious cases.
And, you know, when it comes to becoming more serious, like you say, is it because maybe it's left for too long? Or is it as dangerous as you've explained it immediately?
Well, I think it is a disease that can present in different ways.
Okay.
Obviously, if it is untreated, that can result in severe disease. The critical issue is to prevent diphtheria, and we do have very effective vaccines against diphtheria. These are offered as part of our childhood vaccination program, and we offer boosters to children at 6 and 12 years. And in fact, we will also be vaccinating pregnant women against diphtheria from next year. So really our emphasis needs to be on prevention. We do also need to make sure that our healthcare workers are alerted and are looking out for cases of diphtheria. Obviously, sore throat and hoarseness are very common symptoms. Many people present with those symptoms every day. So it can be difficult to make the diagnosis, particularly when it is the index case, someone who does not have a history of exposure to other cases.
And I know that it occurs in 2 forms, if I'm not mistaken. There's the respiratory and cutaneous diphtheria, right? So which one is viral right now at the Pollsmoor Prison, or it doesn't matter?
So the cases that have been identified in the Western Cape are the respiratory form. So there, as you have indicated, there was one patient who presented with symptoms and who sadly developed complications and did pass away from the condition. The other cases, most of them currently are asymptomatic. So those cases have been identified through laboratory tests as a result, of their history of contact with the index case. So these are predominantly the respiratory forms, which are the severe forms that can result in the complications and death.
So how does this spread? I mean, I remember during COVID times, it was, we had to put masks on and social distance because it spread through just breathing the same air with someone, or if they talk and spit in your eyes. That's how you would also get COVID. So with this one, how does it spread?
So diphtheria also spreads through respiratory droplets, and can also spread through contact with infected surfaces. So in addition to vaccination, just standard hand hygiene, cough hygiene that we all learnt about during COVID.
Yeah.
It is important to maintain these practices. It may not result in complete prevention of spread, but certainly spread will be reduced if everyone follows standard hand and cough hygiene practices.
Doc, would you advise people to, is it time to also just go make sure that you have the vaccine for diphtheria, or should we not panic? And if we should get the vaccine, is it easy to just go to a GP and get the jab?
So, as I indicated, the vaccine is part of our routine vaccination program for children.
Okay.
So really the most important thing is to ensure that our families, our children are up to date with their vaccinations, have received all the vaccinations. Obviously, in response, as part of the response to the outbreak, health officials are vaccinating contacts and staff at Pollsmoor. Other people, if they are concerned, can also go to their GP or their pharmacy and request to be vaccinated. But any child, any person who has received their full childhood vaccinations, the full schedule of childhood vaccinations will be protected.
All right. And what's the efficacy? How long does it stay in my system after getting the jab? How long will I be protected before I need to get a booster?
So historically, we have believed that if children have received the full course of vaccinations, they should have lifelong protection.
Okay.
Obviously, over time, some of this does change, and it is something that some of our expert committees will be looking at.
Because I'm thinking
however,
mutation.
as I indicated, currently our understanding is children who have had the full schedule of vaccination should be protected.
All right, so there's no mutation, because obviously I'm asking you all these questions because it's the jargon we learned from doctors such as yourselves during COVID-19. So does it also mutate because it's respiratory?
So no. So
Okay.
in fact, if diphtheria is actually a bacteria.
Yeah.
And what's interesting about diphtheria is it's not the bacteria, the infectious agent that causes the disease. It's actually a toxin produced by the bacteria. And so when we vaccinate, we provide protection against that toxin. Because of that, there is no risk of mutations or development changes in the same way that we saw with the coronavirus. Still, the standard vaccine will continue to provide protection against diphtheria.
And Doc, typically, how long is isolation if you are diagnosed with diphtheria?
So the isolation period is usually around a week to 10 days. So of course we need to quarantine people who have been exposed while they are awaiting their test results to see if they have become infected, and any case that tests positive needs to be isolated.
All right, Doc. Thank you so much for your time and answering all my questions. Dr. Lesley Bamford from the National Health Department. If you've missed it, there is one 19-year-old prisoner who has passed away now at the Pollsmoor Correctional Centre. He passed away, I believe, on Sunday after showing signs of diphtheria, sore throat, swollen lymph nodes, etc. He passed away, and doctors have now found out that about 8 other prisoners have displayed the same symptoms. They are in isolation, and those who were around them have also been put in isolation. So we know that, for instance, our prisons in South Africa, there's been a lot of debate around whether or not they're too full in terms of how many people are in a cell. But we'll be speaking to Singabako Nxumalo at 2 o'clock for him to answer those questions for us. We understand that there are health department officials at Pollsmoor Prison busy vaccinating all of those who might have been in contact, including the correctional services employees.